Hello, my name's Robin Harling. I'm an acupuncturist here in Severna Park. My clinic is called Stillwater Acupuncture Clinic, and I want to talk to you today about the pandemic we find ourselves in and some of the ways you can take care of yourself. So uncertain times that we're in, and it's real easy to let fear take over. But I have a lot of respect for the virus, but not fear for the virus. Fear can make you helpless, feel like you're helpless, but there's a lot you can do. There's a lot you can do for prevention. There's a lot you can do if you have symptoms. Exposure to the virus is inevitable, but how do you prevent severe infection? How do you prevent severe illness? And how do you promote recovery? So we're going to talk about that today. Let me assure you that sitting in a sterile, enclosed environment is not how you build an immune system. So what can we do to help build that immune system? Acupuncturists are trained to look at prevention and root cause of illness, and we're also trained to look at the individual having the symptoms. So different from Western medicine, right? That's based on symptoms and protocols that don't necessarily take into the consideration the individual or the root cause of the symptom. Also, not a lot of preventive training in Western medicine. So we don't want you to wait till you have symptoms to treat the symptoms. We want you to be proactive. And, just as a reflection, this traditional Western medicine that we have is not really working for Americans. We have the highest number of COVID cases, and it's not surprising to me because before this pandemic, we were not really healthy. The World Health Organization list of longevity ranks the U.S. number 46. We spend the most money on healthcare, by far, the most money on healthcare, and we are not healthy. We are number 46 on that list. Just to give you an idea of who's around us, Panama, Croatia, Cuba, Oman. Oman's number 50, we're 46. Our neighbor, Canada, with its socialized system, is number 16, 46. So we're not healthy. So I hope this crazy time that we're going through is at least a good wake-up call for a lot of you to take control of your health. Look outside the traditional system. There's so much that you can do that doesn't take expertise, doesn't cost money, and no one should feel helpless. But we don't want you to wait until you have symptoms, right? We want you to be proactive, preventive. We want to make you an inhospitable host. So prevention, of course, everything you're hearing, wash your hands, wipe down surfaces, wear a scarf, cover your neck, right? A mask is now mandated in Anne Arundel County. Stay at home, social distance, and there's a lot more that you can do to protect yourself. So I recently heard this interview with Tom Brady, and he was asked why he rarely gets hurt, and he said that he doesn't wait till he gets injured, right? He's not going to wait till he gets injured and then rehab. He said that he does those things every day that he knows keeps him healthy. And he was talking about exercise, nutrition, sleep, stress relief. He has a daily routine that makes him inhospitable to injury and illness. So similarly, I'm not going to wait till I get sick before I do anything different. I have things in my daily routine that I know will keep my immune system healthy. So we're going to talk about nutrition, exercise, breathing. It's a respiratory illness. Breathing is important. Sleep, emotions, physical techniques, supplements, and herbs. Okay. So nutrition and water. This could be a whole series of talks. So much information out there. People have their particular views on specific diets that speak to them. But I'm really only interested in making sure you know how imperative nutrition is to your health and to symptoms. Okay, people are very reluctant to acknowledge this still, and it confounds me really. But food is the way your body gets the chemicals it needs to function. We're one big biochemical process, right? The body can only use what you give it. So food can heal or harm the body. And it's individual. You have to look at your symptoms, right? What's going on with you? What kind of foods does your body need at a particular time in your life? And there's just so many great resources out there now about physicians healing patients with food. Dr. Dean Ornish in cardiovascular and heart disease. Dr. Terry Walls with autoimmune disease, curing autoimmune disease with diet. Dr. Josh Axe and gastrointestinal disorders. Dr. Mark Hyman, the Truth About Cancer website. All of these are scientifically sound, proven protocols from MDs using food to eliminate disease. And I would really recommend, checking into that a little bit further if you have symptoms, any kind of symptoms, or you can email me. You can email me and ask me. But so how does this work? How is food medicine? But I'm going to give you just two great examples, vitamin C and vitamin B3, which is niacin. So if you are deficient in vitamin C, most of us are thinking, oh, what am I going to get a cold if I don't have enough vitamin C? Okay, vitamin C deficiency can cause joint pain, nausea, diarrhea, weakness, exhaustion, poor wound healing, dental decay, swollen gums, loose teeth, personality changes, and death. The disease, if you are severely vitamin C deficient, is called scurvy. And all of these things happen in a body because of the lack of one nutrient. And there are hundreds we need for optimal health, but all of those things can happen because you're deficient in one nutrient. If you have scurvy, adding that one nutrient, vitamin C, cures scurvy, cures the disease. Right. So I'm reminded of a client I had. He was a young guy, about 23. He had he's coming to me for knee pain. And he had knee pain, teeth issues. He was depressed. He was anxious. He was nauseous. He had constant diarrhea. And he was sent to me by an orthopedic. So he went to an orthopedic for his knee pain. Nothing wrong with your knees structurally. Orthopedic sent him to a rheumatologist. Doesn't have rheumatoid arthritis. He was also seeing a dentist for his teeth issues and his gum issues. He's going to a counselor for his mood issues. He's going to a gastroenterologist for his nausea. So in our 2-hour intake, I don't know if you've ever had acupuncture before, but the intake is long. Mine's about 2 hours. We found out that his diet consisted of fast food, 1 or 2 meals a day, and muffins, crackers, soda. There's no vitamin C, crackers. There's no vitamin C in chicken nuggets. Lots of soda. So what are the chances that his diet had something to do with his symptoms? It's pretty high. And this is not unusual. So this guy was seeing an orthopedist, rheumatologist, dentist, counselor, gastroenterologist. Nobody talked about his diet. Linus Pauling won the Nobel Prize in Chemistry in 1954 and did extensive work on the effect of vitamin C in the body. They're still studying micronutrients at the Oregon State University, the Linus Pauling Institute. Linus Pauling recommended 2,000 milligrams a day for optimal health, physical and mental. When you got to 2,000, that's where he saw most symptoms. Vitamin C affected most symptoms positively. He said the first 250 milligrams was the most important for optimal health. The recommended daily allowance of vitamin C is 60 milligrams. So nowhere near what we need for optimal health. But most of those recommended daily allowances are the bare minimum to prevent illness. In this case, 60 milligrams bare minimum to prevent scurvy. It's not what you need for optimum health. Okay. Another quick example, vitamin B3. Niacin, niacin is B3. Niacin deficiency is called pellagra. And in the early 1900s, here in the U.S., 1900 and 1940, it was very, very common to have pellagra. The U.S. had entire hospitals devoted to treating the disease. We had pellagra hospitals. The symptoms of pellagra are what we call the 4 Ds: diarrhea, dermatitis, dementia, death, from an absence of one nutrient, B3. It was thought to be contagious when we didn't know what it was. It was thought to run in families. It was thought to be transmitted by flies. It was very common in the South, more common amongst the poor who subsisted on mostly corn and cornmeal. And the mystery was finally solved by a Dr. Goldberger. He's a New York physician whose wife was from the South and noticed it wasn't such a big problem in New York. And he looked into the diet of the people suffering and sent a wealthy diet of meat, eggs, milk, vegetables to an orphanage and an asylum, pellagra disappeared. So it was quite a mystery for 50 years. And B3 is the cure for pellagra. So if you have any symptoms, look at your diet. Nutrition is imperative, okay? So in Chinese medicine, to fight respiratory illness, because this virus is respiratory, it's important to eliminate what we call dampness in the body. Dampness is caused by foods like sugar, dairy, cheese, ice cream, processed food, right? Eat more live foods, greens, vegetables, fruit, meat, fish. Eliminate the dead food, processed food, bags, boxes, soda, canned, frozen, microwaved, right? Add those foods that are known to be antiviral: garlic, oregano, ginger, peppermint, echinacea. So a friend of mine, or a teacher of mine, said, if you want to feel alive, eat live food. If you want to feel dead, eat dead food. And it's true, very true. It's also important to note that these two conditions that I talked about, scurvy and pellagra, have mental symptoms as well as physical symptoms. Nutrition is very important for mental health, and a great resource for this is Dr. James Gordon. He's a psychiatrist at the Director for Center of Mind-Body Medicine in DC, and one of the originators of the Food as Medicine Conference. He's doing great work with nutrition and mental health. So what you're giving your body to create your body is paramount, right? Very important. Also think about, how much we eat. So in the U.S., we are overfed and undernourished. So just because you're not hungry doesn't mean that you're giving your body what it's need. We're overfed, undernourished. Look to the nutritional value of the food that you're eating. Water, too. Look at what you're drinking. So many hidden calories and hidden sugar, chemicals in what we drink, okay? Drink clean, filtered water. I have a reverse osmosis machine, fairly cheap, easy to install, works really good, takes all the chemicals out of the water, but really eliminate sugary drinks, dairy drinks, soda. Who's still drinking soda? I don't know. Okay, so number 2. Exercise. You have to move, and you have to move every day. Again, we could talk for days on what movement is appropriate, and again, it's individual. But most important, walk, stretch, move every day, right? We are in the middle of a pandemic of a respiratory virus. So really important to keep your lungs healthy. Exercise so that your lungs work and expand. Rebounding, a mini tramp is a great way to stimulate the lymphatic system. But you can also do jumping jacks, large arm circles, anything that moves the energy through this upper part of the body and gets you breathing deeply. Tai Chi, Qigong, ancient healing movements, also very therapeutic. They incorporate breath work. Again, I'm not the expert on these modalities, but a lot of things are online. Here in Anne Arundel County, we have local experts on Tai Chi and Qigong at the Jingying Institute. So make some calls, look into it, but move the body. Avoid stagnation. So breathing. So Chris Cuomo had a great video on his experience with COVID, and relates that his physician gave him advice on breathing deeply and expanding his lungs while he was going through his recovery period. He said it was very painful to take those deep breaths, but the physician stressed how important it was to keep the lungs healthy, keep the lungs breathing deeply. One quick breathing exercise I do in my office with almost all my patients it's called 4-5-6, or I call it 4-5-6. But breathe in for 4, fill the lungs, hold it for 5. So hold the breath for 5, and then a slow exhale for 6. Count for 6. So in for 4, hold it for 5, exhale for 6. We would say always breathe through the nose, breathe in through the nose, out through the nose, and do 4 to 5 reps, 2 to 3 times a day, and you will feel, that part of your body loosening, and you'll feel the lungs relaxing, filling, and relaxing. Dr. Andrew Weil has a lot of good breathing techniques on his website, so there's a lot of different breathing techniques that you can do. But be conscious of how you're holding your breath. So when we're afraid, right, we tend to hold our breath. We're not taking deep breaths, or we're not expanding the lungs. It's not great for the lungs. Keep the lungs expanded, keep the lungs moving. Do some breathing exercises. Sleep is also really important. Sleep is restorative and healing, physically and mentally. So do what you can to assure 7 to 9 hours of sleep. Just because people are home doesn't mean they're sleeping. And again, this is something, you know, I spend a lot of time talking about in the office. We could spend a lot of time talking about it, but use the resources that I'm going to list here, and make sure you get 7 to 9 hours of sleep. Moving the emotions. In Chinese medicine, all symptoms, all dis-ease has its root in an unexpressed or unmoved emotion. Sometimes we call it stress here in the US, right? But for me, stress is really a throwaway term. Everyone's stressed, right? But we have to think about what's causing your stress. So take the time to name it. Move the emotion. Is what you're feeling fear? Is it anger? Is it worry? Is it unhappiness, lack of joy, grief? If you identify the source of the stress, it's much easier to process it and keep the emotion moving. Sometimes just taking the time to identify it can alleviate a lot of the stress. But the important thing, keep things moving, right? The emotion is never the bad thing. It's living in the emotion, not processing it. And it's different for everyone, right? We have to remember that lots of people go through situations, but the emotional reaction is different. And it's the same thing with the virus. We have to remember a lot of people are getting it, but lots of different outcomes, right? So don't get stuck in that fear. There's lots of different outcomes for this virus. But how your body is prepared to handle it is imperative. Okay. So acupuncture is a great way to move emotions, my favorite way. But there is also a great technique called EFT, emotional freedom technique. Sometimes it's called tapping. And it looks like this. So you're tapping certain acupuncture points on the body, right, to relieve stress, right? And it's a protocol. It's a whole routine of tapping different acupuncture points. Dr. Joe Marcola has very good instructions on his website for how to do tapping, but it's a really good emotional release technique. And Dr. Joe Dispenza is also one of my favorites. He is a great source of meditations, and he talks a lot about the science behind meditation and the science behind how you can change your thinking so that you're not living in that emotional reaction of fear, right? If you're living in fear, your immune system is not functioning optimally. We all defer or default to certain emotions. So this is a good time to think about, what's my emotional default when things are stressful? Dr. Dispenza would say your personality is your personal reality, and your reality is how you think, act, and feel. So is it time for you to reprogram some of your emotional responses to things? Remember, they don't come from outside yourself. And if you take the time to reset these negative responses, it will definitely positively affect your immune system. So let's talk about some physical techniques that you can do at home. Gua sha is something we do here in the office. It's a scraping technique. It's used to treat pain a lot, but also used to treat respiratory conditions, so cough, asthma, bronchitis. We're going to talk about gua sha. We're going to talk about cupping. Both of these can be found if you want to look it up and really, see how you get a tutorial online. Is Dr. Arya Nielsen at Pacific College. So lots of good information there, but I'm just going to show you what I do in the office a little bit. I'm just going to show you the tools. So these are gua sha tools. You don't need one of these. At home, you can use a spoon and use just the side of the spoon. But gua sha is a scraping technique. So, you're going to scrape the skin. I'm showing you on my arm, but both the gua sha and the cupping that I'm going to show you should be performed on the upper back to relieve respiratory congestion, okay? So when you do this on the upper shoulder, you want to start at the spine and scrape toward the arm. So start at the spine, scrape toward the arm. And you want to do firm scraping in one direction, right? You don't want to do back and forth. Okay, so just in one direction. And we're doing this on the shoulder to relieve respiratory congestion. Okay, and there'll be some redness that comes up, and that's good. Okay, the other thing that we do a lot in the office is cupping. So these are cups. This is, I use this suction. Traditionally, we would use fire to create the suction, but I use this. So again, on the skin, 2 pumps, and then we leave the cup on the area, again, for respiratory congestion, the upper back. Okay, also used a lot for pain relief. If you have tight muscles, you can do cupping. And you leave it on there for 5-10 minutes. Okay. Sometimes it leaves a little mark if you're relieving stagnation, and that little mark will go away in a couple days. And again, if you're interested in that, you can contact me, or lots of good information at pacificcollege.com, Dr. Arya Nielsen. Supplements. Okay, so once again, I want to remind you what Tom Brady said in his interview. He lives every day like he's going to get injured, so he eats, sleeps, exercises, thinks in a proactive, preventive lifestyle. And I do think this is why I have respect for the virus, but not fear, because I do things every day that make me an inhospitable host. And I'll show you what I take. So of course, this is not a treatment protocol. If you feel sick, go to the doctor. This is just what I do, okay? So recently I heard Dr. Peter Ekman in a recent interview talk about research surrounding sesame oil, untoasted sesame oil, and preventing the upper respiratory system from the virus. So this is a respiratory virus. The goal is to not let it get into the lower respiratory system, the lungs, right? So he suggested some sesame oil, some organic sesame oil, Q-tip in the sesame oil, and coat the nostrils. Something about sesame oil that doesn't allow the virus to attach to the upper respiratory system. So why not, right? It's a good no harm intervention. I do it when I go out. If you feel like you're getting a sore throat or a cough, you can gargle with warm water, salt, apple cider vinegar. Cleans the throat. It can help, and it helps the pain of the sore throat too. You can gargle 3 to 4 times a day if you feel like it's landing in your throat. I take daily 2,000 milligrams of vitamin C, because that's what Linus Pauling said, for optimal health, right? 2,000 milligrams of vitamin C in ascorbic acid form. That's important, ascorbic acid form. I take Ester C or Emergency, whatever I can get. It's actually been hard to find. I take 200 micrograms of selenium a day. I take a zinc lozenge twice a day. I take 2,000 IUs of vitamin D every day, and I take astaxanthin. And in the winter, starting about in October through April, I take elderberry syrup that I make. So I've got a good recipe for that if anybody wants that too. So I take that every day. That's like my normal. When COVID entered locally, I began an herbal protocol from my supplier, Woodland Essence. It is a protocol that is based on Stephen Buhner's recommendations for coronavirus. So this is the book that he wrote, and Woodland Essence uses his suggestions for a coronavirus tincture. And let me show you these. Okay, so this is, whoops, I don't know if you can see the label, but it comes as a packet. They're tinctures. I take it twice a day, and they are formulated for the coronavirus. And I just heard from another doctor, Dr. Frank Hanel, who's talking about his treatment choice for COVID is the hydroxychloroquine we've all been hearing about. It's a malaria drug, and was explaining how the quinine affects the virus, and explained that there are trace amounts of quinine in Schweppes tonic water, and recommended drinking some every day. So why not? I've added that too. It's a good no harm, way to help. So, these are the things that I do, and I'm going to give you the resources and that I listed, but find a good routine. Find something that makes sense to you, and seek out good news from physicians treating that don't seem to make it onto prime time, right? One is Dr. David Brownstein. He's an MD at the Center of Holistic Medicine. He has treated a couple hundred COVID patients. None have gone to the hospital. None have died. His website is posting what they have done and how successful they are. If you have any questions about that, you can call me or email me at robin@stillwateracupunctureclinic.com. But do something, right? Do something. Work on your movement, work on your nutrition, your sleep, moving your emotions, stress relief, breathing, getting off those screens and electronics, and adding supplements to your daily routine. Add all those things in that we know are good, no harm ways to protect yourself, drop the fear, and make yourself an inhospitable host. Thank you.